Hi, I'm Dr. Susan Benedict. I'm here on behalf of my friend Kathy and her dog LuLu. I'm doing a chiropractic form of manipulation on her dog. LuLu has been a past patient of mine, and she often has trouble with her right back leg and sacrum. And what I'm going to do is go from kind of head to tail and do a little bit of assessment. My fingers are checking for differences in temperature. We're checking for what we call bogginess, which is if you have a lot of fluid around a joint, it's going to feel a little bit squishy, whereas a non-inflamed joint will feel a little more tight. And then I also look for the reaction of the animal, and this is for all animals. When we do our head to toe, they will react if something is sore. They'll turn their head. They'll give a reaction. So that's what we look for. And LuLu has been a very compliant patient, and also she heals up very fast. So after a manipulation, she's her old self again. She goes on walks and tackles the stairs, and for an older dog, that's a big difference. LuLu. She has a little bit of trouble with her rear right leg, and I've adjusted her before. She sometimes has sacrum, which is back here as well. I'm going to check LuLu for bones out of place. Here, sweetie. Yeah, it's a very gentle procedure. This is her atlas. Okay. And I very gently go down and I'm palpating her spine. And I'm watching for a reaction from her. Okay, she didn't like that one, and there was a reaction on this one too. I can feel it, huh? Okay. Okay. You know, this is interesting, Kathy. She's better than she has been.
Really?
She's a little bit, because before, remember, this was all inflamed pretty much. Her sacrum, and she had a whole bunch of, her sacrum now. Okay. All right. You ready? Okay. Okay, here we go. So I'm going to do her head first. These are very gentle manipulations. You have to roll a little bit, baby girl.
Here, do you want me to help?
Yeah. Can let her just go back.
There.
Will she roll
okay?
over? I don't want to. I think she doesn't want to put pressure on that right hip.
Should have cleaned you up more.
Now I'm fixing what I found. As I'm doing a little bit of kinesiology here, I'm also testing to see which way.
Sometimes it almost seems to be like it's a right leg itself.
All right, we're sitting you back up. Here's my girl. So all the joints in this leg are off. There's a torque. See if she's splaying out or splaying in.
It's okay.
Okay. Here we go, Lou. We've done this before. I felt that move. So her whole leg was down and in, and it has a little bit of torque to it.
On the left side? Even though
Well,
she exhibits more in the right.
I like to fix the other side first,
Okay.
and then just recheck it.
Come on, sweet.
All right. I'm using a very gentle thumb toggle. It's called a thumb toggle. It's one thumb over the other, and then a little snap, which gives enough force. Very, very minute force. Now let's see what this guy's doing. Down, forward. Now does it have a rotation?
The way she holds her palm, she just...
This one's in a lot worse shape. Okay.
I almost thought she had something in her paw, the way she wouldn't put any weight on it, but I looked and there's nothing.
All right, sweetie pie, you ready?
Do you want me to stand here?
I'm just going to stand her up one last time.
Come on, honey.
There you go.
There.
I know it's not comfortable. I know that. I'm just correcting for rotation. So I'm going to check these other joints. That's interesting. So this section was down and these two are up. And when they're jammed up like that, they're trying to compensate. Alright, so let's just check this cartilage and joint space in here. I know. We're almost there. I know you're going to feel better. Alright, so this is like a joint capsule. And if you just palpate this from side to side, you can feel how puffy this one is. And this side isn't. So she's got a little inflammation going on in here.
Okay.
Probably give her like a little anti-inflammatory.
He gave her some Duramax, which is anti-inflammatory and pain. It helps.
She's still on it?
Yeah,
Okay.
she is.
Yeah, it is a little inflamed.
And losing weight. He said it's causing too much problems on the joints.
So what does she do? She gains more. Okay. I'm just going to double check this one. See, she wants this side up because then there's no pressure on it. That's what it is, isn't it?
You want me to stand her up again?
Okay. Just going to do a last check.
Wow.
Make sure I didn't miss anything. Yeah. See how relaxed she is though?
Uh-huh.
Did we get them all?
Yeah, quiet.
I'm just going to work with her sacrum a little bit. Almost done, LuLu. Almost there. Ooh.
Wow. Yeah, I saw her react to that.
You okay? These are micro movements, so you know she's inflamed. Barely moving. Now I'm gonna put my other hand where all that inflammation is. I'm gonna see if we can loosen up this joint between the leg and the these are just little tiny movements. You okay with that? Dog outside. Doggy's gone.
See, good girl.
Getting back to this little.
She's a little bit mighty.
Oh dear. The small ones those are. Oh dear. This is kind of addressing the soft tissue component after I move the bones. Just giving that inflammation a little chance to, it's fluid and it needs to go back into the tissues and stop being so boggy on that side. Is that better, sweet girl? Well done. Okay. Go get him, Lulu. Thank you. Well, you're welcome. You're very
She's
welcome.
always so much better after she gets an adjustment.
She's resilient, boy. She just
We have
sucks
no
it up and goes.
We have no idea how old she is because she's a rescue dog. So,
Oh.
and you know, I'm sure she has arthritis and she may be older than they told us. And you know, we are adjusting her food so she loses that extra pound because that can be a lot on joints.
Sure, for a little dog.
Yeah,
Yeah.
for a little dog.
Right.
But say that again. Lulu loves to see Dr. Susan.